How you doing? I'm Dr. Patel. I'm a board-certified plastic surgeon, and I specialize in upper and lower body lifts. I just want to give you a little bit of background of body lifts and who are good candidates for it, the procedure, and the recovery. Most people I see who are interested in upper or lower body lifts, there's two different categories, are patients who've had usually a significant amount of weight loss. It usually entails any form of surgery where we're doing almost like a circumferential procedure addressing the core area or the trunk area. The most common are patients who've had weight loss surgery, bariatric surgery, or especially now with all the semaglutides patients are on these days, I'm seeing a lot more patients with anywhere from 50 to 150 pound weight loss. So what we're doing is, unfortunately, a lot of these patients, they were miserable when they were overweight, but they've traded one problem for another problem. Now they are having issues with loose skin along their belly area. They have breasts that have lost their volume, they're droopy, and they got prominent bra rolls and even back rolls all the way down, and their clothing doesn't fit comfortably, and they're very interested in options to kind of address this. So when I see patients for this, first of all, the most important thing is we want to be at a weight that you're stable at. Once you're at a weight that you've been stable at for 2 to 3 months, you're a great candidate to be evaluated for a body lift procedure. And the procedures do entail multiple ones, and I'm going to start off working our way from the top all the way down. It could be anywhere from a mid-face neck lift, because people get loose skin, especially they get a turkey gobble looking neck area. They want to tighten that up. And I will do neck lifts in very young patients who've lost a lot of weight too, because they develop a lot of loose skin. Then working our way down from that, we deal with the arms. You've heard of the term bat wings, so we can get rid of the bat wings. And you'd hate to be the person who has to buy t-shirts based on the circumference of your arm skin and then wear a very loose shirt on top. So we will contour the arms, sometimes with the arm lift or a skin tightening procedure, and that way they can wear shirts that are more custom to based on their chest size, not their arm size. And then when we get to the breast area, multiple options for the breast. Anywhere from still further breast reduction, we can talk about breast lifts, we can talk about breast augmentation, which is adding an implant, or a combination of a breast lift with an augmentation. We get those breasts repositioned up at a higher location and give it a full tone look. And then on top of that, a lot of women have problems with bra rolls. You know, when you put the bra on and you have that skin that rides over the top of the bra, it's really uncomfortable, it's painful. We can get rid of that. We can either liposuction your bra roll area, or we can do what we call a direct excision, where we cut out the skin that's overriding it, and that entire scar can be hidden in your bra line or a bathing suit top. Then if we work our way down, we're talking about the tummy area. So that includes a tummy tuck with muscle tightening, and then those tummy tucks sometimes can be a circumferential whole body lift. We're removing the skin and what we call those excess rolls sticking over the top of your jeans. We can get rid of those. And then we follow that up with your inner thighs. We remove excess skin from your outer thighs and inner thighs, and that way your pants can feel more contoured, and when you're working out, you don't feel that constant rubbing. So if you're interested in any of these procedures, definitely get evaluated by a board-certified surgeon. Make sure your health status is fine in regards to your nutrition parameters are fine, your protein intake, because especially with significant weight loss, you can have problems with that. So once you know your protein status and your numbers are fine, you're a great candidate for this surgery. The surgery can be anywhere from 3 to 6 hours, depending on how many areas you're addressing. It's outpatient surgery where you go home, you recover. You typically will have drains in for anywhere from 1 to 2 weeks, depending on the area of the body we're addressing. And then the recovery you can expect is anywhere from 4 to 6 weeks. But after that, usually you could space out each of these procedures probably about 2 months apart. That way you can get multiple procedures done in a shorter amount of time. So if you have any other questions, please feel free to reach us in the office. Happy to meet with you to present a very personalized and dedicated plan based on what your goals are. Thank you for your time.